group. Oh,
All right, go ahead.
hi everybody. This is our group, International Health Project, and we decided to take on Sierra Leone, is the region that we've chosen, and their safe birth. We want to implement a safe birth program, and this is presented by Michaela Lee, Courtney Messer, Julia Lowell, and myself, Deborah Bowden. So the reason we chose Sierra Leone is because they have one of the highest maternal death rates in the world. In 2015, 1,360 mothers died out of 100,000 during childbirth. And like I said, that makes Sierra Leone the highest mortality rate in the world. Yeah, that was according to this interagency group. It's the World Health Organization and UNICEF and a couple of other groups. The most common cause of death is due to hemorrhage and lack of a ready blood supply for transfusions. And so the mothers just bleed out and they perish from blood loss. The second most common cause of death is obstructed labor requiring surgical intervention or a cesarean section delivery, and that happens quite a bit. The other contributing factors include village home births, lack of pre and postnatal medical care, lack of sanitation, adolescent pregnancies, untrained birth attendants, malaria, and nutrition. Okay.
Okay, so an overview of our implementation is that we are going to be making delivery health kits, and these sterile delivery health kits will be made through donations from different organizations, and they will be given to trained birth attendants. And in these health kits will include methods to control bleeding, prenatal vitamins, instructions, and they may include pictures and in those instructions, clamps, cord ties, sterile razors, gauze bandages, blankets, and soaps and other disinfectants. So, yeah. And as part of the intervention, local birth attendants will be certified annually. They will be trained to handle at-home deliveries and learn how to identify high-risk deliveries. Okay.
All right, so our next part is why our intervention will help solve the problem. Delivery kits, they're really there for two things. One, to help create a safe and free from infection delivery, and also to help the mother during her delivery. According to the World Health Organization, 15% of maternal deaths are due to infection. So with these kits, including the clean sheets and the soap and the sterile cutting things, it will help reduce infection. And also, another one of the biggest reasons for maternal death is hemorrhage. So these kits will also include instructions, counsel, and items to help control bleeding. And many women are not allowed or cannot make it to the hospital for delivery, and that's probably why Sierra Leone has a huge maternal death rate, because many women cannot make it to the hospital or aren't allowed to by their husbands. So these kits will assist them in birth and also help make the delivery as smooth as possible. And these kits will by the delivery attendant or when they go into a hospital if they make it there. And then we're going to train the birth attendants, and just kind of a background of it. So Sierra Leone implemented a free healthcare system for pregnant women and children under 5. Good thing for those that can make it to the hospital or like to go to the hospital, but it has caused a lack of birth attendants because they don't feel any motivation to be trained because they're not going to be paid, and they don't really see it as worth their time. And so with our intervention, we will offer compensation to birth attendants, as well as compensate them for each delivery or each prenatal visit. And so this will help two things. This will help create jobs for many women in Sierra Leone, so that will help the economy, as well as the biggest thing is these trainings will help the women that don't deliver in the hospital. They can help catch problems or high-risk pregnancies, informing them that because of their pregnancy they need to go to the hospital or find a way to go if they're serious, as well as just take care of problems that occur with home and self-delivery, motivation, anything that they need help with that they can't do themselves, or that will create a safer delivery for them.
So for implementing in Sierra Leone, this intervention, we would first divide Sierra Leone into 4 different regions to allow the local birthing attendants better access to the training. The training of the birthing attendants is important because it can reduce the amount of deaths during births. And the training attendants would be trained to be prepared for complications during the birth that they could help with. They would also be trained to use proper sterilization techniques, and this could reduce the amount of infections that end up killing the mothers after giving birth. The last thing the local birthing attendants would be trained in is early pregnancy appointments to be able to foresee any possible complications during birth, such as the pelvis being too small to pass the baby. By having early pregnancy appointments, the mothers would be aware of the risks that could happen when giving birth and possibly prevent the complications from happening by using different birthing approaches. The training of the local birthing attendants would be a 2-day training in a central location in the region they are split up into. The 2-day training would occur once in the beginning, and then they would attend a 1-day recertification every year to allow them to keep up on their certification. And in order for the birthing attendants to be compensated for their time and talents, the government would need to enforce room in their healthcare system to pay the birthing attendants for each birth they do and the training they attend. Our intervention would include a letter to Sierra Leone's government explaining why this would be beneficial to them and ideas of how they can make it happen. If the birthing attendants were being paid for their labors, they would care more about the work that they do. With the sterile birthing kits that would be accessible to pregnant mothers and an early pregnancy examination and training the birthing attendants, the death rates of mothers after giving birth would decrease.